Unfortunately, there are no medications that are approved for the treatment of pediatric sleep disorders, including melatonin, which is probably the most commonly used. So there's a lot of room for improvement from there. And as such, there's very few clinical trials looking at the efficacy of these medications for children. So most of our evidence is actually based off case series, case reports, or observational trials. And so I think that that's really where, as a parent, you really want to know the efficacy, the safety profile of these drugs that we use. But on the other hand, many people have good anecdotal evidence showing that many of the commonly used medications that we use are in fact safe, but not well studied. Kids having more options for drugs is very important, and because there's a lack of data, oftentimes it's very difficult to get these medications even covered by their insurance companies or whatever their payers. So the sodium oxybate trial, I think, is a very good example of that. This is a very effective medication for the treatment of pediatric narcolepsy, and is now being covered because of a good clinical trial that was being done and receiving FDA approval. Other medications that I think are certainly promising are things like the orexin agonists that are coming out for patients with narcolepsy, because it's a more targeted therapy for this patient population. And I think newer drugs like pitolisant that were recently approved by the FDA have promise for children too, and there's currently an ongoing trial for pediatric narcolepsy. Yeah, I think CBT is incredibly important, and for one, because oftentimes pharmaceutical drugs do not provide 100% benefit. I always sort of explain that medications can help to a certain point, but the rest has to come from like good sleep hygiene and other things. So behavioral therapy can be helpful for kind of coming up with a routine that works for a patient. So in my case, in the hypersomnia cases, scheduled naps, regular sleep hygiene, are of course very important, and I find that the cognitive behavior therapy also helps with medication adherence. And I think, to me, cognitive behavior therapy also helps gives patients some ownership of their disease and gives them some agency, and to me that's very helpful for preventing things like depression down the line.